name's Heather. I'm a physical therapist at Elite Spine and Sport Physical Therapy. A couple weeks ago, I had a Parkinson's workshop over the weekend, and I wanted to give the opportunity for everybody else to hear that information if they're also interested. So what we're going to talk about, if any of you are interested in the slides, please feel free to reach out via Facebook or email, and I can send them to you. But the topics we're going to go over today is just to review the disease process for those of you who don't know much about it, symptoms and staging, what we find to be the biggest mistake that patients with Parkinson's disease make, the two different extremes in the landscape as far as what are the big issues that most patients encounter. And we want to go over a really highly supportive treatment technique that we actually offer here at Elite. And we just wanted to do a little bit of practice just so you can get excited about it. So what type of treatments have you all experienced in the past? So everyone's different. Some people are new to this and you haven't had any treatment yet. But a lot of times throughout the staging of Parkinson's disease, you'll at least have some time that you're going to see an occupational therapist and or a physical therapist. Medical management is a huge part of this. I'm sure a lot of you are already on some medicine regimen. Different fitness programs. So if you've ever heard of Parkinson's disease programs specifically that were Tai Chi, yoga, there's rock steady boxing locally. And some of the more new things we're looking into is the idea of deep brain stimulation. So I personally know someone who has tried that with Parkinson's disease. And there's lots of clinical trials out there, which if that's something you'd be interested in, there are tons of websites that you could be a participant with. So that's always something to consider too. Like I said, though, I'm sure some of you have had this for quite some time, and some of you are new to the game. So some of this may be a review. For others, it might be the first time you're hearing it. So just kind of bear with me if it's a little bit of a review. So what is Parkinson's disease? It's a chronic progressive movement disorder that affects both motor and non-motor function. So I'm sure throughout all of this, you've heard really different things, really big words, which I'm going to break down today, that don't always make sense, and it's hard to remember how to spell them when you're looking them up on Google. But what motor functions are, so think about motor being movement. So that's the kind of things like maybe you'll start to not walk as well. Maybe your balance gets thrown off. Maybe your movements are just smaller. Those are motor issues. Non-motor is more like your quality of life. So maybe your sleep's not going well. Maybe you are starting to have bowel and bladder issues. Maybe you're depressed and you're feeling isolated because you can't do the things you once could. So that's another side of things that Parkinson's disease does affect. And at this point, there is an estimate of at least 1 million people in the United States that are living with Parkinson's right now. Several websites have shown that it's even higher than that. But oftentimes people are diagnosed in their 50s. And oftentimes they'll get the diagnosis, but once they realize what's going on, they're like, hey, I've had these symptoms for quite some time before that. So everyone's a little bit different. There is definitely an early onset for some people. Some say that they have it a little bit worse. Some say that they progress slower. Everyone's different. So it's kind of like any issue we have. Everyone is unique, and that means that everyone's going to kind of have their own story with it. So what exactly is going on? I made this very simple because I can tell you neuroscience is one of the most confusing topics I've ever had to do in school, but it's super interesting. But what's going on is there's this small area of your brain called your substantia nigra. And what that is there's little neurons there, which are like the functional nerve cells. I'm going to try not to get too sciencey on this. And they're in this little part of your brain. But what happens is in a person that doesn't have Parkinson's disease, they have enough of these nerve cells there. But for someone that does have Parkinson's disease, they either don't have as many or they're kind of damaged. So what happens is these nerve cells produce something called dopamine. So since Parkinson's patients have it that dopamine isn't being produced well enough, it's not getting sent out to your body. And what the problem is that dopamine is trying to tell all your muscles to just move. So if you're not getting as many signals to move, that's definitely a problem. And what actually ends up happening with patients who have Parkinson's disease is that they feel like they're moving big enough, but they're not. Their loved ones are seeing it. Their coworkers are seeing it. And the patient does not realize it at all. And that's because of this dopamine not being produced well enough. So everyone kind of wonders, why me with any disease process? Why was I the one that had to get this? So there's a ton of research going on right now to try to figure out why Parkinson's disease happens to certain people. So there's a couple different things. One is a genetic component. So roughly 10% of the people that have Parkinson's disease is because of a gene mutation. So just as if you'd have Down syndrome, there's a gene mutation on a chromosome. Another interesting thing that they have found is that there are certain populations that have a higher likelihood of getting it. So there is a Jewish population that's more likely to have it, and people that are of North African descent. So for some reason, there's some genetic component to those two cultures from certain areas. The other thing that's really interesting is that they're starting to see it's not all about a genetic thing, but also kind of the environment you're in. So there are different people that were exposed to things over war times, whether it's heavy metals, pesticides. You're hearing different things about Agent Orange in the literature, that could increase the chance of having Parkinson's. But you're also seeing things that are like head injuries. So I'm sure a lot of you have heard how Muhammad Ali, being a fabulous fighter, actually ended up having Parkinson's disease. And they're really curious if that head trauma was linked to him getting Parkinson's. Another interesting thing is research has shown that males are more likely to get it than females. Not entirely sure why. And then there's also things too. So people don't always just have Parkinson's disease. They could have something called Parkinsonianism, which is things are presenting like it, but you didn't get the diagnosis. You know, that area of your brain, the substantia nigra isn't affected, but you have symptoms so similar to it. And there's other things like Lewy body dementia, different types of Alzheimer's that can manifest the same way. So it's not that you have to have Parkinson's disease to be limited by symptoms that are kind of like it. So the idea, what have you started seeing in yourself or in your loved ones, for whoever's tuning in? Have you started to see the change in their posture? So there's this little schematic, which I can even show you, this little guy, and it's called TRAP, okay? So the things that you start to see is that tremor. A lot of the patients I've worked with, that was kind of their first thing, that they're like, something just feels off. Now, some patients tell me it's an internal tremor, which I find really fascinating, and that no one can see it, but they feel like their insides are quivering. You can also see it that out of nowhere, they'll start to have a shake of their hand or their foot. That's a pretty telltale sign that something neurological is going on, and it'd be worth seeking out a neurologist to kind of start the conversation. Another thing you'll see as Parkinson's progresses is this sense of rigidity. And what that means is, instead of moving nice and fluid, you're more like the Tin Man. So you're not as easy to walk. It seems more effort is required. So that's another thing you'll start to see. And it's not just in their arms and legs. Their trunk gets stiff. They'll lose the ability to turn their head more naturally. Another thing you start to see is something called akinesia. And that's that you start to lose power of voluntary movement. So what that means is you'll just start having movements that you have no control over. And like I said, posture and balance. With anyone in an aging population, these are things that we start to see, and Parkinson's disease just increases that. So it just shows you the importance of having to have treatment to try to counteract these things. There's different stages of Parkinson's disease. Some people are told what stage you're at. It doesn't necessarily matter, because we'll still kind of, any therapist will kind of work with you no matter what stage you're at and meet you where you're at. But there's normally 5 stages that they go by. So the first stage, you'll see more things of just kind of like one hand being an issue, one foot being an issue. As you progress to stage 2, you might start seeing things in both sides of your body, but you're still able to do things pretty well on your own. In stage 3, that's where you start seeing that slowness of movement, the balance becomes more of an issue. You might be at an increased risk for falling at that point. Stage 4 is when it gets to the point that all these things are just progressively getting more challenging, and living by yourself might be a challenge and it might not be safe anymore. And then stage 5 is when you may need caregiver support, whether it be a spouse or someone that comes into the house, and it might be a lot harder to move and walk on your own, to the point that you might start needing wheelchairs, things of that nature, or like a walker. And like I said, everyone's different. Some people don't ever progress quickly. Some people progress quickly, but everyone's different, and everyone's neurologist should be able to kind of at least have a little bit of an idea. But like we said, we can't predict the future. You can predict how well you can help yourself though. So the single biggest mistake people with Parkinson's disease make. So think about it, me being a physical therapist, but I think a lot of people would agree with this, is you're not moving enough and you're not staying active enough. So you start seeing that your balance is getting worse. You start seeing that you're not talking as well and interacting as well. And it kind of makes you more of an introvert and you're afraid to leave your house. So what you'll see is when people don't move enough and they just kind of become a couch potato because of everything being really stressful, you'll see an increased risk for falls. You'll see that their balance continues to get worse. They'll lose that sense of independence and happiness that they have with being out in the community and seeing friends and family. And that idea of depression can truly start to kick up when people start to limit their ability to be out in the community. So, like I said, the two extremes of the landscape. I have a bunch written down because I'm sure you've heard a lot of these. So I want to kind of talk over some of them because some of the words are kind of crazy and you're like, what the heck does that even mean? So like I said, the tremor is a very common thing if we're talking about the motor side of function. So like I said, the two extremes are motor issues and non-motor issues. We're going to go over both. Bradykinesia, if you've heard that, that's definitely a telltale sign of someone who has Parkinson's disease. And that's the idea that your movements are getting slower. So you think you're walking fast or at a normal speed and you truly just aren't. Another thing you'll see a lot of is people will lose kind of the strength and the awareness of some of their facial muscles. So their volume will get smaller. They'll be more likely to drool. They might start having their eyes tear up more. Another thing you'll see, back to the walking side of things, is something called festination. So if you've heard this word, don't know what it means, it's that idea that when you start walking, you can't stop. And it's not like you're taking big safe steps, you're taking little steps, and it really increases your chance of tripping and falling. Another really common sign in Parkinson's disease is something called freezing. So you are trying to get up, and when you want to take that step forward, it's like someone glued your feet to the ground. That's a really common thing. You'll see when people are trying to make a turn, just trying to start a movement. Very, very common thing to see. Another thing you'll also observe is your loved ones might kind of lose their facial expression. So back to that idea where drooling's more likely, eye watering's more likely. It's that idea that they have this masked expression. And I can tell you one of my favorite things is getting one of my patients to smile because it makes my day. But it's something they got to think about way more than the average person has to. And the other thing, so that my idea of everything getting smaller, people will also start to notice that their penmanship gets really small. So it not only gets small, but it's hard to read it. So those are all really common motor symptoms. So again, movement related symptoms that we'll see with Parkinson's disease. Now, non-motor is more, like I said, that quality of life thing. So you'll start to see some people will have mood disorders. You know, they're changing medications frequently. Maybe they have other things going on. So maybe their Parkinson's medication isn't working well with that. I know physicians have a hard time sometimes finding what works best for someone. Cognitive changes, what that means is mentally you might not be as sharp as you used to be. You might be more distant. You might kind of be cloudy when you do things. You just can't think as clearly as you used to. Some people hallucinate. I've met several people that have. Some people hallucinate weird things that are scary. A lot of times, like I know someone that hallucinated that they had cats running around their feet, and the only reason they knew that wasn't a real thing was because they didn't own cats. So different things like that are sometimes hard to tease out because you don't know what's real from what's not. Orthostatic hypotension is that idea that with all these medicines they're on, when they stand up, their blood pressure drops. So that could, again, be a reason why you'd be at increased risk for falling. Like I said earlier, you can have issues with bowel and bladder function, which can also kind of be a physical issue too. It's kind of both, because that can definitely affect your quality of life too. People will also see increased fatigue, increased weight gain, again, for that idea that you just don't want to get up and move as much as you once had. People will also experience pain for that same reason. If you go from being a very active individual to not moving, you might start getting back pain, hip pain, all that stuff, just because you're not moving like you should. And oftentimes people can have impulse control. So what you would see as, you would never say that in public. Every now and then, extreme cases, people will say stuff that they don't want to say, but they don't have control over saying it. That's not the most common symptom though. So I want to go into what we offer here at Elite. So there are tons of different things, like I said earlier, that you can do to treat Parkinson's disease. And again, None of these are going to be cures. They're all just to manage the disease as it progresses. So the approach that we do here at Elite is called LSVT Big Training. So what that is it's a program that is backed by 25 years of research, and it's all about high intensity, large amplitude movements. So what that means is we're going to try to really hit home on the idea that walking's not going well, that posture isn't good enough, that balance is getting a lot harder, and that people start to lose their independence at home. So maybe you're not getting out of bed very well anymore. Maybe it's hard to get up off the toilet or off the sofa. And maybe it's hard for you to just do things around the house. Maybe you can't wash the dishes or get dressed by yourself anymore. So this program was designed specifically to kind of take a big bird's eye view of a lot of the issues Parkinson's patients deal with and try to address them in a therapy setting. So the reason why this whole entire thing started is a woman by the name of Miss Lee Silverman. So that's why the program is called LSVT. So what it stands for is the Lee Silverman Voice Treatment. So you're like, voice, we're not talking about voice right now. So what happened was this woman was diagnosed with Parkinson's disease, and her family was really struggling to communicate with her. She was definitely pretty advanced in her disease process, and they had a quote that kind of like resonated. I'm sure some people feel this way too. They said, if only we can hear and understand her. They knew she was in there, but they felt like she was almost trapped inside of her body because her Parkinson's just made everything so small to her. So in, I think it was, 1987 to 89, out in Scottsdale, Arizona, there is a team of speech therapists, physical therapists, neurologists, a whole bunch of people that decided to start trying to find a program. So the woman that was really responsible for it was Dr. Lorraine Ramig. She is a speech therapist who is working on, I believe, her PhD. And she started making this program to help Parkinson's patients kind of find their voice again. So the entire idea of this program actually started off of the speech therapy side of things. So what LSVT Big is it's kind of a deviation from it. So they saw all the success in someone's motor function for speech. So they found that they could talk better. So what a bunch of therapists and doctors thought, like, hey, why can't we make the rest of the body move better? So that's why LSVT Big was created. So like I said, it's been backed by a lot of research. And the cool thing about it is that we can really make a huge difference with this. So what makes it interesting is that when you look at LSVT Loud, it's 7 different tasks that you have to do. So LSVT Big mirrors the same thing. So what it is every day you need to do 7 daily exercises, and they're all about just getting your posture to be bigger, getting your movement to be more fluid, and just finding your balance again. And the cool thing about that is then, so you have that you'll do every day, but we also will kind of sit down and figure out, what are you struggling with at home? So like I said, some people are struggling with getting in and out of the bathtub or getting out of bed. Or, some people are like, I really just want to get back in the community and feel comfortable walking through the grocery store and that someone's not going to make me lose my balance. So each person will have a program like that where they'll have some form of these 7 exercises, whether it be that you need to do it sitting because you don't have good enough balance to stand yet, whether you do it standing, whether we really push you and make you do it on foam. Everyone's different, and our hope is that everyone can progress to do at least some of it in standing and make it more challenging. But the thing is, in a perfect world for this to work, so when they did all this research, they did it in a rehab setting. So I don't know if any of you have ever been there before, but it's kind of the idea that you'll actually live at that place until you're better. So the translation of doing this into outpatient is that you have to be so stinking good at your homework. So if we work really hard in here, you have to work just as hard at home. And that's where people struggle. So for people like that, and I've come to find with the ones I'm working with now, if you feel like you can't do the intensity that's required, we can always do a different approach for therapy. And maybe this specific program isn't perfect for you. But that's the idea, where it'd be great for us to kind of get to see what we think would work best for you. But a lot of people are nervous about, what are my barriers, right? What about the cost? So this, as with any other physical therapy, insurance will cover it. We can justify why you would benefit from it. So just say you typically have a $20 copay for physical therapy, that would be no different here. And a lot of people with Medicare, that covers it once you pay your deductible. So I'm sure if you've had therapy in the past, you will already know that. But that's something that our front staff girls are rock stars at, and they can talk to you about that. People also get concerned, maybe you're really interested in this, but you don't have a doctor's script. So what do you do then? So at our physical therapy clinic, as well as other places, therapists can have something called a direct access license, I being one of them. And what that means is we can actually have you come in without the doctor's script. And as long as you provide your primary care doctor, your neurologist, if you give us their name, I can write up the eval, or one of my colleagues will send it over, and that turns into our script. So direct access works really well for that reason. And what if you have driving or transportation issues, or you're really nervous about COVID still? So what we've luckily, with how, not that it's a good thing, but with how the world's going, we as therapists have access to telehealth visits now, which is a really good thing, because if you want to stay at home, we can still be here just like I am right now, having the treatment with you. It'd be wonderful if a loved one's there to kind of help you through things. But if you're someone that maybe only want to come one time a week and do a couple telehealth visits, that is totally fine, and we can make that work too. So your question, why are we different at Elite? So I know there's tons of programs in the area that help patients with Parkinson's, which is wonderful. And I've heard wonderful things about all of them. But I think the thing that makes us a little bit different right now is maybe you have had treatment in the past, but right now we're going to meet you where you're at. Maybe 10 years ago you had care and it went really well, and now you're kind of down in the dumps because you're like, I'm way worse off. This is never going to get better. That's not true. If you put the effort in, there is definitely a chance that you can see a really good change, but it's a lot about how much you want to see the change. I can only help you for a couple hours a week, so you got to be really on top of yourself to be dedicated at home. But the nice thing too, every one of these sessions, since patients are going to be higher risk for falls and balance issues, you'll have one-to-one attention the entire time, which I think is very helpful. So that way I can kind of cue you here and there where you need the assistance. And at Elite, we have several therapists who are trained in LSVT big. So we all are really interested in it, and it's something we are really passionate about, and I think that shows through. I will say I'm super hoarse because I had several patients in a row and they weren't being loud enough, so I made them be louder, and my voice took a hit as a result. But what I want to do, just to get you a little bit more excited about it, I would like to show you two different techniques that you can see a pretty big positive change in. The first one's just the first exercise we would do daily, just to show you how big I want you to move. And then the other one is kind of a quick trick just to show you how simple movements can make things go a little bit better. So like I said, the 7 daily exercises that we would introduce to you, if you're appropriate for the program, are all about just moving big and really stretching out. So bear with me, I'm gonna try to scoot back and hopefully you can see me. Yes, okay. So everything we do is about having really big posture the whole time. So I always tell my patients, setup is so important. So instead of sitting like this, we're gonna do a big starting position. My posture is not gonna be here. I'm gonna be up nice and tall. The first thing you're gonna do, you're gonna reach forward. You can follow along at home. Reach down as far as you can to the floor, up to the ceiling, and back. And for the first 2 of these 7 exercises, you count to 10 and you stretch as much as you can the whole time. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, finish big, okay? So that's where people, they'll give me a little smack, and that's where you can tell my volume kicks up, because I want them to be louder than me, and I want your movement to be just as big as mine, if not bigger. So that's the first one. And for each of these exercises, you do a pretty high intensity. So when you're in the therapy session, if you're here for 60 minutes, you are busting your butt for 55 of them. So the idea is to overwhelm that part of your brain that just isn't doing what it's supposed to. So we're just constantly making it work harder, do it better, work hard, do it better. And it is really effective, like I said, if you work hard here and work hard at home. So the other thing is, like I said, a lot of times people have issues with fine motor controls. That's the idea that, you know, maybe getting your glasses off and on is hard. I have women saying that getting their earrings, their necklaces, that's really tough. I actually just had a guy who enjoys a piece of chocolate every night. And we worked yesterday on him being able to open the wrapper without ruining the chocolate, and he was so excited about it. So stuff like that. Like, I want you to think about things that might seem silly, but have meaning to you. Everyone can have goals that can be totally off the wall, but if something that makes you happy and it means something to you, that's totally worth working on. But the next one, okay? So a lot of people struggle with buttons and zippers. So what people do is they'll get stuck here and they can't seem to pull it apart, okay? So for me, not challenging. But there's this idea of something called flicks. So I want you guys to try that if you're following along at home. So they kind of struggle. So these flicks kind of reset your brain and just kind of distract the bad signal, okay? So you kind of flick out the problem and then you try to do it again, okay? So this really, really makes a difference for whatever reason. And it's just retraining your brain to just not be distracted and overwhelmed by it. But I'll see people who struggle and do it twice as fast after doing flicks. Same thing can be said for when you're tying your shoes. People get hung up on it, and that idea of those flicks, aggressive flicks, not little ones, I want big ones. Those are what really can help make a difference with fine motor tasks too. So we're almost finished. I'm sorry I'm talking your ear off, but what I just want to let you all know, I appreciate you all tuning in, and I just want to let you know that we are actually offering a free 30-minute consultation for anyone who's interested and would like to see if they're appropriate for this program or just more balance or strengthening, whatever it could be. But what we want you to do, the next step, if you are interested and you want to do this, you can either email Elite Physical Therapy, not email rather, go on Facebook and message us on Facebook, or you can give us a call at 570-970-0402. And if you do want the email, it is elitespinesportpt@gmail.com. So that's also an option. And it's no S on sports, it's just sport. So I really appreciate you all tuning in. I hope that in the next week I get to eval some of you and meet some of you, because I think this is a really awesome program and we've been seeing great results. So I hope to see you all soon. Take care.